Christina did well the remainder of her pregnancy. Jessica arrived a few days after her due date and weighed just over 7 pounds. Even though Christina did end up taking insulin to control her blood sugars, she has said she would happily do it again to ensure the good outcome of a healthy, normal weight baby. The provision of healthcare services to individuals, families, and/or their communities by at least 2 health providers who work collaboratively with patients and their caregivers, to the extent preferred by each patient, to accomplish shared goals within and across settings to achieve coordinated, high-quality care. We next see Christina about a year later. She has seen the nurse practitioner, Meredith, every 6 months to determine if her blood glucose levels are staying within the normal range. She has continued to see Kelly for regular cleanings every 3 months. At her last visit with Kelly, she talked about being worried about her general health. As a result of this, Kelly has called a team meeting to discuss Christina's concerns. The final scene of this case study takes place in the conference room at the clinic. Team members Kelly, Meredith, and Christina are joined by the medical director of the clinic, Dr. Eli Brumfield.
Hi, Christina. I'm Dr. Brumfield, the director here at the clinic. I'm so glad to meet you. I'm always excited to participate in these collaborative planning sessions with patients. It is an opportunity for each of us to appreciate each other's valuable contributions to care.
Hi, Dr. Brumfield. It is good to meet you.
Well, to start out today, Christina shared with me at her last prophylaxis appointment, and we are doing 3-month interval appointments, that she's really worried about developing diabetes. And that's why I called you last week, Meredith, to set up this team meeting.
I really appreciated that call, Kelly. I think this is a great opportunity for us as a team to work on this issue. So, Christina, can you tell us kind of exactly what you're worried about?
I'm really worried about developing regular diabetes after having gestational diabetes during my pregnancy. My dad has had diabetes for years and has heart problems as well. I don't want to suffer the way he has, and I want to be here for Jessica. I just want to make sure I'm doing everything I can to stay healthy.
I'm so glad to hear you say that you're committed to staying healthy. We always find that when we have a committed patient member such as yourself, we do well. Is it all right if we start with our oral health first, Kelly?
Sure. Her gingivitis has become so much better with her 3-month interval cleanings, but I'm not getting the resolution that I'd like to see. Christina, can you tell us a little bit about your oral home care habits?
Yes, I have been religious about brushing with my ultrasonic toothbrush and flossing twice a day.
Good job, Christina. The daily home care is critical to a healthy mouth. It may take a little more time to get the healthy pink gingiva that we'd like to see when we know that the infection is becoming more clear and stable. What I think we'll do is continue with the 3-month interval cleanings and make sure that Christina is brushing and flossing to take off the plaque that is causing the infection. So Meredith, what insight can you give us from the medical perspective?
Well, what I can tell you is that Christina has lost about 8 pounds, and this is great. Weight loss increases insulin sensitivity, and that in turn reduces your risk for type 2 diabetes. So what have you been doing, Christina, to lose weight?
I have been walking for 30 minutes during my lunch hour every day at work, like we talked about. I have also continued to eat healthy. Like Meredith said, I have lost 8 pounds, but I would like to lose just a few more.
Well, it sounds like you're doing a great job all the way around. You certainly have addressed what you can do to reduce your diabetes risk factors.
I agree. Good job. You know what we haven't addressed is Christina's genetic predisposition to type 2 diabetes. I've been following her A1C levels since her delivery, and they have been creeping up in spite of the lifestyle changes she's been able to make. The last reading, it was 5.9%, just crowding the upper normal. So I've been thinking that perhaps her after meal blood glucose levels are just high enough it may be contributing to the bacterial growth in her mouth. You know, the American Diabetes Association guidelines on prevention of type 2 diabetes suggest we might want to consider adding metformin at this point.
The Diabetes Prevention Program found that in women with a history of gestational diabetes, the addition of metformin with intensive lifestyle modifications has led to a 50% reduction in the development of type 2 diabetes.
I like those odds. I think it will help. And I still want to keep up with the daily exercise and healthy eating.
Well, it sounds like to me we have a great evidence-based team plan approach to help Christina lower her risk of developing diabetes.
And that's a good thing. Christina continue with her new healthy lifestyle habits along with the additional metformin, which is a good drug for you as it is weight neutral and won't interfere with your goal to lose a few extra pounds.
So team, is there anything else we need to reconsider today? I don't think so. I think we can stay on top of Christina's status through the electronic medical record. And should anything happen that we need to talk about, we can easily set up another team meeting. Christina, is there anything else you'd like to talk about today as we wrap up?
No, I don't think so. I feel better now that I will be taking a medication. I was just afraid we needed to be doing something more. Thank you all for meeting with me today.